skin is warm and dry to touch. He's appropriate for the weather. Hello, my name is Erica. I'm a student nurse. I just come to do a head-to-toe assessment. And what is your name?
Vincent Sanders.
Vincent Sanders. Nice to meet you, Mr. Sanders. Mr. Sanders, can you tell me what year it is?
2017.
And who's the President of the United States, Mr. Sanders?
Donald Trump.
Okay, and what's your date of birth, Mr. Sanders?
February 16th, 1968.
Okay, very good, Mr. Sanders. I'm going to give you 3 words, and I want you to remember those words. The words are blue, ship, and 3. What 3 words that I want you to remember for me?
3 blue ship.
3 blue ships. Thank you, Mr. Sanders. Okay, well, I just introduced myself to Mr. Sanders. Like I said, he's well groomed. His skin is warm and dry to touch, not cool and clammy. It's within normal limits. Mr. Sanders, if you don't mind, I would like to go ahead and do a head assessment on you. So what I'm going to do, I'm going to palpate Mr. Sanders' head. I'm going to feel the symmetric of his head. I don't feel any lumps or bruises in Mr. Sanders' head. And I don't see any bruises. Okay. Mr. Sanders' eyes are symmetrical with his ears. They line up properly. I'm feeling Mr. Sanders' frontal sinuses. Do you feel any pain, Mr. Sanders?
No.
Okay. And his maxillary sinuses. You feel any pain, Mr. Sanders?
No.
Okay. And while I'm doing that palpation, I'm going to go ahead and I'm looking at Mr. Sanders' eyes. I'm looking into his lateral glands. I don't see any drainage, any yellow discharge. Eye seems to be normal. Mr. Sanders, what I also want to do while I have you, can I go ahead and ask you to open your mouth for me, Mr. Sanders? Close your mouth. Okay, I just checked Mr. Sanders for any TMJ, and he doesn't appear to have any type of clicking, or his jaw doesn't seem to stick together during the TMJ examination. Next, what I'm going to do, I'm going to do a check for Mr. Sanders' cranial nerves, number 5 and number 7. Mr. Sanders, can you do me a favor and wrinkle your forehead for me? Very good, Mr. Sanders. Can you clench your teeth for me? Can you close your eyes? Okay, close them real tight for me. Very good, Mr. Sanders. Can you smile? Can you frown? Can you lick out your tongue? All right, Mr. Sanders, very good. Next thing I'm going to do, what I'm going to do is give you a light sensation. That means I'm going to do a couple of little touches, and you let me know if it's where the touch is, if it's soft, or if it's kind of a hard or sharp touch. I need you to close your eyes for me.
Soft. Left cheek. Right. Hard. Chin hard. Forehead soft.
Very good, Mr. Sanders. I just did check Mr. Sanders' cranial nerves 5 and cranial nerve number 7. Next, I'm going to talk about Mr. Sanders' cranial nerve number 2. Prior to coming in for the examination, Mr. Sanders did take a snelling test from 20 feet away, and what he did was scored a 20/20 on the chart without glasses. We also did the Rosenbaum test, where he read the newspaper 14 inches away, and with that, Mr. Sanders' vision was properly without glasses. Next, after that, I'm going to also check once again Mr. Sanders' eyelids and his eyelashes. I've already done that. There's no flaking, no lesions, no inflammations noted. I did check the lateral glands, and also when checking his lateral glands, I'm also going to check his conjunctiva, which is white, and his coronals, which are brown and round. And what I'm going to do, Mr. Sanders, I'm going to use my pen light, and what I'm doing is shine a very bright light in your eyes. And if this was a normal test, I would dim the lights And then I would check to see if Mr. Sanders' eyes pupils were equal and reactive, ready to light accommodations. So I'm going to go ahead and I'm going to check Mr. Sanders' eyes, and they are round. And they do react unto the light. Thank you very much, Mr. Sanders. Next, after this, I'm going to check Mr. Sanders' cranial nerves 3, 4, and 6. And what I want you to do, Mr. Sanders, I want you to look directly into my nose and you watch my pen light as it moves. And what you're going to do is going to move. I want you to move your eyes to the direction it moves to. Very good. Very good. Very good, Mr. Sanders. Very good. Okay, very good. So what I just did, I checked cranial nerves 3, 4, and 6. Mr. Sanders' eyes did move as the ocular motors as I checked his the 6 cardinal fields. Next, what I'm going to do, I'm going to do a coronal reflex, which cranial nerve number 5. Mr. Sanders, what I'm going to do, I'm going to take this Q-tip and I'm going to wisp it in your eyes, and if you blink, that means you have good coronal reflexes. Very good. Thank you, Mr. Sanders. I just checked cranial nerve number 5 with the coronal reflex. Mr. Sanders, next what I'm going to do, I'm going to inspect and palpate your ears. So what I'm doing, I'm palpating Mr. Sanders' ears, feeling for any nodules. Let me know if I'm hurting you or anything, Mr. Sanders.
Nope.
No pain. Good. Ears are within normal range, and like I said, his eyes and his ears do line up correctly. Mr. Sanders, also with your ears, what I would like to do for you is do what was called the Weber and Rhines test. So with the Weber's test, what I would do, I would take the tuning fork and I will hit it, and I will allow Mr. Sanders to let me know if he feel any vibrations in bilaterally, which both ears or within one ear.
Yep.
Okay. Now I'm going to check for the Rhines test. Let me know when you don't hear any noise.
No.
Okay. Okay.
No.
Very good. So now I'm going to do it. And let me know when you stop hearing the tuning fork, Mr. Sanders.
No. No.
Very good. What I did did check Mr. Sanders' ears with the Weber and the Rhine test, and everything seems to be normal. Next, what I'm going to do, I'm going to inspect Mr. Sanders' nose. Mr. Sanders, what I'm going to do, I'm going to look at your nose, look at the septal defect. The septum it lines up symmetrically. I'm going to look at Mr. Sanders' nose. I don't notice any drainage, no redness. Do an examination. Very good, Mr. Sanders. I need you to close your eyes for me. And what I'm going to do now is check for cranial nerve number 1. Mr. Sanders, tell me, what do you smell?
Alcohol.
Alcohol. Very good. I just checked Mr. Sanders' cranial nerve number 1, the olfactory nerve, to check for smells. Next, after that, I'm going to check Mr. Sanders' mouth. So what I'm going to do, I'm going to don me a pair of gloves prior to me checking his mouth. All right, Mr. Sanders. What I want to do, I want to look in your mouth and see if you have any scarring, any lesions. Your teeth are symmetrical, no sores. And now what I'm going to do, Mr. Sanders, I need you to open your mouth for me. Stick your tongue out and check for Mr. Sanders' gag reflex. Very good, Mr. Sanders. I noticed that there was a gag reflex. I checked So Mr. Sanders, I'm going to go ahead and look at your neck. It seems symmetrical. Your trachea is not deviated. It's aligned with the rest of your body. I'm going to palpate. I don't feel any masses or any scars. I don't note any masses. I don't see any scars. palpating your thyroid. It seems to be normal. Mr. Sanders, what I need you to do for me is correctly swallow this. Drink some water and hold it in your throat. And what I'm going to do is assess your thyroid. So to assess Mr. Sanders' thyroid, I'm going to come behind him and want to ask you to swallow. Go ahead and swallow for me. Okay, thyroid. It's palpable. Do you feel any tenderness, any soreness when I touch you down here, Mr. Sanders? Okay, very good. All right, next I'm going to palpate Mr. Sanders' lymph nodes. Okay, so we're going to palpate Mr. Sanders' lymph nodes. I'm doing the periocular, preocular, postocular, occipital, submaxillary, submental, superficial anterior, deep cervical, post-cervical, and bilaterally the post-cervical, super anterior cervical, and inferior anterior cervical, and supraclavicle, clavicular. Okay, Mr. Sanders, what I'm gonna need you to do, I need you to, I'm gonna add some pressure. I want you to resist my pressure. I need you to shrug your shoulders for me. All right. I'm assessing cranial nerve number 11. Now, Mr. Sanders, what I'm going to do, I'm going to oscillate your carotid to make sure there's no brooch. Okay, hold up, look at me. Very good. Patent. Don't hear anything. All right, very good. Mr. Sanders, thank you. I just assessed Mr. Sanders' neck. I checked cranial nerve number 11. Next, we're going to do the chest, lung, and heart. Mr. Sanders, I'm going to inspect your chest, lung, and your heart. So in a normal examination, what I would do, I would take my stethoscope and touch it to Mr. Sanders' skin when I'm doing my assessment. So now I'm looking at his skin. Like I said, it's warm and dry to touch. There seems to be no sweats. Skin is not clammy. Checking the anterior and posterior and the chest. His lungs do rise and fall without any signs of distress. Mrs. Sanders, what I'm going to do now, I'm going to percuss on your lungs. Now what I'm going to do, Mr. Sanders, I'm going to auscultate your lungs with the stethoscope. Like I said before, that if this was an actual examination, I would use my stethoscope to skin. Mr. Sanders, let me listen to your lungs. Deep breath for me. Let it out. Deep breath for me. Let it out. Deep breath for me. Let it out. Very good. Deep breath for me. Let it out. Deep breath for me. Let it out. Deep breath for me. Let it out. Very good. Lungs are clear. No wheezing, no rails. Now I'm going to listen to Mr. Sanders in his front. Okay, deep breath in. Let it out. Deep breath in. Let it out. Good. Deep breath in. Let it out. Deep breath in. Let it out. Very good, Mr. Sanders. Okay, Mr. Sanders, what I'm going to do now, I'm going to listen to your heart. What I'm going to do is listen to the aortic. This is the aortic valve. Alright. This is the tricuspid valve. Very good. Mitral valve. Heart tones are normal. S1 and S2. Alright, now what I'm going to do, I'm just going to expect Mr. Sanders' JVDs. Hold your neck up for me at a 45-degree angle. So if Mr. Sanders was laying back a little bit at a 45-degree angle, I'll be able to assess his, you're not going to be able to do it. Well, this JVD. Alright, Mr. Sanders, sit up. Very good, Mr. Sanders. What I need you to do now is lay back, and what I'm going to do is now auscultate your vowel sounds. So what I'm doing now, I'm expecting Mr. Sanders' abdomen. I'm also expecting his abdomen, and after that, what I'm going to do, I'm going to auscultate all 4 quadrants of his abdomen. All 4, listening to his vowel sounds. Okay, I'm looking for Mr. Sanders' diaphragm. Mr. Sanders' diaphragm. Hold up, let me put the camera so they can actually see me. Auscultate now. My valves now. Okay. Okay, I do hear hyper vowel sounds, normal vowel sounds in all 4 quadrants. Mr. Sanders just had dinner, so his stomach is digesting his meal pretty well. Next, what I'm going to do, I'm going to percuss Mr. Sanders' valve. Okay. Okay, what I'm going to do, I'm going to estimate Mr. Sanders' liver size. So, the normal liver span should be between 7 to 12 inches. Mr. Sanders, after marking his area, is 7 inches. All right, very good, Mr. Sanders. Now what I'm going to do, I'm going to palpate your abdomen. Let me know if you feel any pain or any tenderness. You feel any pain or any tenderness, Mr. Sanders?
No.
Okay. Very good. Are you feeling okay, Mr. Sanders?
Yes.
Okay. Sit up for me. All right. Just assess Mr. Sanders' abdomen. Now we're going to sit back on the edge of the bed for me. After doing all of this, now I'm going to check Mr. Sanders for his musculoskeletal, blood vessels, skin, nails, and upper and lower extremity strengths. All right, checking Mr. Sanders' capillary refill. Pinch. It goes back to a normal color in less than 2 seconds. After that, Mr. Sanders, what I need you to do, I need you to hold your arms out for me. All right, as I pull, I need you to, very good, very good, very good, very good, Mr. Sanders. You can relax now. Okay, now I need you to take your arms back. You feel any soreness, any tenderness, Mr. Sanders?
Nope.
Oh, okay. Don't notice no deformities. Arms are symmetrical. Shoulders are even. Mr. Sanders, next thing that I'm going to do, I'm going to feel for your pulses in your wrist. Okay. Pulses are bounding. Mr. Sanders, also what I'm doing, I'm going to go ahead and feel for the pulses in your feet. I'm going to feel for the dorsal pedis pulses. And then I'm going to feel on the inside. All right. Thank you, Mr. Sanders. What I'm going to do next, I'm going to check Mr. Sanders' reflexes while I still have him sitting. Mr. Sanders, I need you to check them bilaterally. So what I'm going to, I'm checking the triceps. Very good. Now I'm going to assess for the bicep. Okay, very good. Now I'm brachial radialis. Very good, Mr. Sanders. Check it bilaterally, so I'm checking it on the other side. Very good. Very good. Brachial. Very good, Mrs. Sanders. On that one, check. Oh, your knees. Very good. The Achilles. All right, very good. Can you take one of your shoes off? And what I'm going to do, I'm check the Babinski signs on Mr. Sanders. On the bottom of his feet. Okay, get it. Sorry, I guess I raised his foot up so you all can kind of see the Babinski signs. Can you raise your leg up for me, Mr. Sanders? Very good. All right, Mr. Sanders, the next thing that I'm going to do, I'm going to check your range of motion. So, Mr. Sanders, what I need you to do is stand right here for me. And I'm going to need you to walk to the other side of the room for me. Can you do that? And when I'm doing that, I'm examining Mr. Sanders' gait. Make sure that it's symmetrical. Now, Mr. Sanders, if you can you put one foot in front of the other for me? Heel to toe, heel to toe, heel to toe, heel to toe. Very good, Mr. Sanders. All right, next thing we're gonna do, we're gonna have Mr. Sanders raise his knee. He's gonna raise his knee for me. All righty. Raise your other knee. All right, can you hop? Can you hop for me, Mr. Green? Okay, very good. All right, Mr. Sanders. The next thing that I'm going to do is I need to check your strength in your legs and your knees and your legs. Can you have a seat for me, please, sir? And lay back again. Okay, lay back again for me. And what I'm doing is assessing Mr. Sanders' flexion for his hip. All right, he able to move his leg up to 90 degrees. Extend. Very good. We're gonna do it bilaterally. Okay. You know when that hurt. All right. Very good, Mrs. Sanders. Relax for me. All right. Sit up. Sit up for me, please.
Okay, you in the way.
Oh. All right, Mrs. Sanders, what I'm going to do now, I need you to close your eyes for me. Close your eyes. This is called this test is to test your neurological sensory function. I'm going to put something in your hand. Stereogenesis. What I'm going to do is put the object in Mr. Sanders' hand. He has to describe to me what's in his hand.
Coin.
Very good. It was a coin. All right, now what I'm going to do, we're going to do graphosynthesis. Mr. Sanders, keep your eyes closed, and what I'm going to do is write something in your hand.
3.
Very good. It was the number 3. Mr. Sanders, remember the words that I told you earlier? Can you remember what those 3 words were?
3 blue ship.
Very good. It was blue ship 3. He memorized it in an order that he could remember. Now I'm going to do a test on your finger. It's called a 2-point discrimination. You, Mr. Sanders, you let me know if this is if I'm sticking you with 1 item or 2. Can you close your eyes for me?
1, 2, 2, 1, 1, 2.
Very good. I used a tool for Mr. Sanders, the 2-point discrimination, and it was 2 and 1 point touch. All right, Mr. Sanders, I think this concludes our test. Do you have any questions for me?
No.
Let me look over my chart and make sure. All right, let's do what is called the tactile frequencies. What I'm going to do is place my hand on your back, Mr. Sanders, and whenever you feel my touch, I need you to say 99.
99, 99, 99, 99.
Very good. Let me go to the front. I did feel vibrations as Mr. Sanders was saying 99.
99, 99, 99.